Welcome to Your Health. I'm your host, Rhonda Alfred. For more than 4 decades, Cardiovascular Institute of the South and Terrebonne General Health System have partnered to bring cardiovascular excellence and leading technology to the Bayou region. With a legacy built on expertise, dozens of new cardiovascular procedures, devices, and innovations were pioneered, setting Terrebonne General and CIS apart from any other cardiovascular program in the state. Joining us on this episode is Dr. Matthew Finn, interventional cardiologist at Cardiovascular Institute of the South, who's going to be discussing with us the conditions of pulmonary embolism and deep vein thrombosis. Welcome to the show, Dr. Finn.
Thanks for having me back.
All right. Well, it's been a little while, but I know you've been really busy in that time. And I know today we're going to talk more about pulmonary embolism.
Yes.
All right. Well, let's get started with you telling us more about yourself and your role at CIS.
Yeah, so I'm local. I'm from Destrehan, right down the way, and I live here in Houma now. I'm a cardiologist at Cardiovascular Institute of the South, and I do interventional procedures. I also see patients for wellness exams. I specialize in coronary artery disease, which is blockages in the heart. Also specialize in blockages in the peripheral vascular system and vein problems, which is what we're going to talk about today with pulmonary embolism.
What is pulmonary embolism, or PE, and how does it start?
Pulmonary embolism is a very broad term. Usually it refers to a clot that typically starts in the leg, usually the upper thigh, and then moves through the heart to the lung and embeds itself in the lung. The usual symptoms are chest pain, shortness of breath, severe fatigue, and trouble walking.
So you should really know if something like this occurs.
It's usually not very subtle, commonly on our differential for shortness of breath and chest pain.
Tell us what made you so interested in specializing in this condition.
It's the third leading cause of cardiovascular death, and over 100,000 cases a year in the United States. So it's a huge problem. And prior to recently, our main treatment was clot buster therapy, which held a relatively high, almost unacceptable major bleeding rate. So in recent years, new technology has been developed to remove the clot via suction tubes and different devices to go into the lung, remove the clot, and make patients feel better almost immediately in some cases.
So what are the risk factors for PE?
Yeah, so we always talk about the classic triad. It's called Virchow's triad. It's stasis is the main one, so not moving, immobility. If you're bedbound from an illness, for example, bedbound from a recent surgery, that'd be a common reason for stasis. Long trips, so we typically ask patients about if they've been in the car. Usually talk a trip more than 3 or 4 hours. Plane trips as well can be included in that. So that's stasis. Trauma to the leg, so any kind of surgery or injury on the leg or any other part of the body that causes stasis can lead to blood clots, but typically we think about the leg. And the last is increased risk of clotting. So a genetic problem in your family history of clotting. There's many genetic disorders that can lead you to clotting. There's other risk factors such as smoking, obesity, older age that can increase your risk as well.
Okay, and how is it diagnosed and treated?
It's usually not subtle. It's going to be it could be a sudden change in your ability to breathe, sudden shortness of breath. Some people can describe the instant it happened because the clot's basically moving from the leg to the lung, so patients notice it. People notice they can't do their normal activities anymore. Sometimes they can't do their normal activities of daily living, even trying to walk up the stairs to your house and things like that. So if you're having those types of symptoms, you need to go to the emergency room so we can investigate for pulmonary embolism.
And how long can someone have a PE without even knowing it?
So usually you do know. There are different forms of pulmonary embolism called chronic forms where you can have slow development over time, but that's relatively uncommon. Only 3 to 5% of patients have that slower chronic form. The more common form is, a sudden change in symptoms. And then people usually complain of symptoms for less than 2 to 3 weeks when they come in.
How have the treatments changed, and what are some of the life-saving procedures that you're doing right here at Terrebonne General?
We're very excited to have these treatments here, and it's been life-changing for many of our patients. and we're very excited about it. You know, the classic paradigm of treatment was clot buster therapy, and as I said before, they carry a very high bleeding risk. Now, it's still appropriate to do it in some scenarios with the clot buster, so we still offer that here as an alternative when we need it. But a lot of times we can go in without giving these medicines and go in with a catheter into the lung and basically pull the clot out and make patients feel better. After we do that treatment, we typically put patients on blood thinners, either the pill form, Coumadin, drugs like apixaban and rivaroxaban or other common ones we use for treatment of pulmonary embolism. And the duration kind of depends on your risk factors and what caused it.
Well, we wanted to cover deep vein thrombosis also. Can you tell us a little bit more about that?
So it goes part and parcel with pulmonary embolism. So typically pulmonary embolism, the clot's in the lung, but it starts in the leg. And some patients, won't necessarily move to the lung. It can just stay in the leg and then cause severe leg swelling. It causes pain. The pain's frequently in the calf. You can sometimes see visible veins. And it's usually pretty sudden. You can get redness and significant edema or swelling. In those cases, we'd really encourage patients to present to either our clinic for an urgent evaluation or to the emergency room to determine if you have a blood clot.
So patients need to really pay attention to what's going on in their bodies.
Yeah, and then if you're concerned, please come see me. I would love to see you over at the CIS clinic in Houma.
All right, tell us how somebody can schedule an appointment.
Yeah, so you can call the front office at CIS in Houma and just ask for me. And I'd love to see them there.
All right, well, thank you so much for your time today. And
Thanks for having me back.
For more information about cardiovascular procedures at Terrebonne General Health System, visit tghealthsystem.com. That's all for To Your Health today. I'm Rhonda Halford, and I'll see you right back here next week.